Hello everybody, David Johnson here, spinal neurosurgeon from the Functional Movement Training Centre. I was really excited when I came across some of this old footage of mine from a trip that I'd made to northern China a couple of years ago, and I was amazed watching it again and really excited to show it to our Functional Movement Training Centre community because it hits home a very important message. Number one, that age and degeneration do not equate to pain and disability. Do these elderly Chinese folks have degenerative discs and facet joints? Absolutely. If I put these people into an MRI machine, I would see the same lumbar degeneration that I see in my patients who are suffering from chronic low back pain. Do they look like they are suffering from poor functional capacity or movement deficiency? Absolutely not. Do we see our elderly community in Australia doing similar functional movement? No, absolutely not. I've never seen a park like this in Australia. These parks like this were scattered all over the countryside in rural China, and this was a cultural activity that was engaged in every day. We have good evidence now that supports low back pain being one of the world's leading cause of disability, and this is seen predominantly in industrialized nations. We don't see this in non-industrialized cultures. Now, this is primarily because these folks retain their movement proficiency from childhood right through until they die. And it's not because of doctors or physical therapists or medications or surgical technology. It's because they maintain the elements of movement proficiency, mobility, coordination and strength, and these make up the elements of good movement. And this is the primary goal of the teachings at the Functional Movement Training Centre and the NeuroHAB program that we offer. It is to restore what modern society has taken away, and a result of modern society taking away elements of movement proficiency is chronic spine pain and chronic low back pain. And there is absolutely no reason why patients who experience low back pain and have all of the elements of degeneration cannot regain elements of movement proficiency and start to reverse chronic pain symptoms. So if you do suffer from low back pain, just ask yourself, how much treatment have you had that specifically focuses on movement proficiency? If you've had rub downs and deep tissue release and massage and a lot of work on the couch or lying on a reformer, the chances are that therapy really has not hit the nail on the head in terms of movement training. And please feel free to give us a call, and I hope you enjoyed the video. Thanks a lot.